6,200 bags of heroin found in Delaware drug bust. Drug bust nets more than 8,000 bags of heroin. Are you missing 15,000 bags of heroin? Because the police in Delaware found them. Horror and hope. Heroin addiction. Girl, 4, hands out heroin at Delaware daycare. Mom pleads guilty. These are just some of the headlines in regards to Delaware's heroin problem that have populated news sources since the beginning of 2015. It is evident through these headlines, as well as statistics, that heroin is becoming a major problem in Delaware, as well as the remainder of the United States and even the world. With this rise in heroin use comes a multitude of other problems our community must face, including the heightened risk of blood-borne viral infection among IDUs or injection drug users, and those who come into contact with them through sex and contaminated syringes. According to the World Health Organization, globally around 16 million people inject drugs, and 3 million of them are living with HIV. On average, 1 out of every 10 new HIV infections is caused by injection drug use. AIDS.gov says over 1 million people are living with AIDS in the U.S., and 1 in 7 do not know that they are infected. 1 in 4 new HIV infections are among youth ages 13 to 24. Most do not know that they are infected, are not getting treatment, and can unknowingly pass the virus on to others. According to the CDC, an estimated 47,500 people became newly infected with the virus in the United States in 2010. HIV incidence has remained relatively stable at about 50,000 infections per year since the mid-1990s. As of 2004, injection drug use accounted for about 1/5 of all HIV infections and most hepatitis C infections in the United States. It is estimated that an individual intravenous drug user injects about 1,000 times a year. WhiteHouse.gov says that as a direct consequence of drug use, 102 persons died in Delaware in 2007, compared to the 118 who died due to motor vehicle accidents and 79 who died due to firearms in the same state in the same year. National Substance Abuse Index says in 2007, there were 1,905 substance abuse treatment admissions for heroin in the state of Delaware. In a single-day count in 2012, 2,460 persons in Delaware were receiving methadone as part of their substance use treatment. In 2010, 3,489 people were living with HIV or AIDS in the state of Delaware. To combat this threat, organizations such as the CDC, WHO, and our local health and social services recommend the utilization of harm reduction strategies. According to the Harm Reduction Coalition, harm reduction is a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. Proponents of harm reduction understand that licit and illicit drug use is a part of our society, and minimizing its harmful effects is more effective than ignoring or condemning them. Harm reduction includes methods such as education, treatment, and the Divided Needle Exchange Program. In 1997, a report to Congress stated that needle exchange programs can be an effective component of a comprehensive strategy to prevent HIV and other blood-borne infectious diseases in communities that choose to include them. Studies showed that to succeed in reducing the transmission of blood-borne infections, programs must consider a comprehensive approach, incorporating a range of strategies that address both drug use and sexual risk behaviors. One of the most important of these strategies is ensuring that intravenous drug users who cannot or will not stop injecting drugs have access to sterile syringes. As stated before, it is estimated that an individual intravenous drug user injects about 1,000 times a year. Needle exchange programs provide a way for the intravenous drug user who continues to inject to safely dispose of used syringes and to obtain sterile syringes at no cost. The National Institute of Health Consensus Panel on HIV Prevention stated, "An impressive body of evidence suggests powerful effects from needle exchange programs. Studies show reduction in risk behavior as high as 80%, with estimates of a 30% or greater reduction of HIV in intravenous drug users." Many people argue that needle exchange programs encourage injection drug use, but this is similar to saying that free condoms promote sex. Studies conducted worldwide found that these programs effectively reduce the transmission of HIV or AIDS and hepatitis. Hundreds of studies of needle exchange programs have been conducted, and they have been summarized in a series of 8 federally funded reports starting in 1991. These 8 reports have concluded that needle exchange programs can reduce the number of new HIV infections and do not appear to lead to increased drug use amongst intravenous drug users or in the general community. A study of 81 cities around the world compared HIV infection rates amongst intravenous drug users in cities that had needle exchange programs with cities that did not have needle exchange programs. In the 52 cities without needle exchange programs, HIV infection rates increased by 5.9% per year. On average. In the 29 cities with needle exchange programs, HIV infection rates decreased by 5.8% per year. In San Francisco, California, the effects of needle exchange programs were studied over a 5-year period. The needle exchange program did not encourage drug use either by increasing drug use amongst current intravenous drug users or by recruiting significant numbers of new or young intravenous drug users. From December 1986 through June 1992, injection frequency among intravenous drug users in the community decreased from 1.9 injections per day to 0.7, and the percentage of new initiates into injection drug use decreased from 3% to 1%. In July 2011, Governor Jack Markell signed Senate Bill No. 13 into law and transitioned the City of Wilmington's first and only needle exchange program from a pilot to a permanent program. Delaware's current needle exchange program is run through Brandywine Counseling and Community Service, also known as BCCS. During the first 3 years, while Delaware Needle Exchange was still a pilot program, over 700 people were enrolled, and over 38,654 needles were exchanged, with the used syringes being incinerated. 150 people were referred to drug treatment with an incredible follow-up success rate of about 60%. Over 1,200 people were tested for HIV. More than half of those were not needle exchange participants, but took advantage of the service being offered. Testing identified new HIV patients, as well as patients who already knew they were positive but were not receiving treatment. They were then linked to medical care and case management, which further reduced the risk of transmitting the virus. They also began pregnancy screening on their vans. The goal of the pregnancy screening was to reduce the infant mortality rate in Delaware by connecting drug-abusing pregnant women to treatment immediately. Delaware's programs receive $211,000 from the Division of Public Health each year. From recent CDC studies, we know that preventing one new HIV infection saves $221,365 in treatment costs. So the prevention of one new HIV infection pays for the needle exchange program for 1 year. In 3 years, Delaware's needle exchange program prevented an estimated of 10 to 12 new infections by connecting nearly 20 people to HIV care. Therefore, they saved an estimated $2 million that would have been spent on treating those individuals. Delaware's needle exchange program, as well as others across the country, have proven over and over that they are effective at reducing the spread of blood-borne viruses, getting contaminated syringes off the street, and connecting people with the care that they need while being cost-effective. These programs need the support of the community.